It was an interesting essay. It will have annoyed some people, maybe even some of those you work with. You were very keen, however, to get the message across. Can you summarise it for us?
I'm very keen to get the message across that the NHS is really no longer fit for purpose. I mean, it has completely failed to deal with the pandemic that was predicted, and they can't deny that. And one of the things I find very annoying is people like Jeremy Hunt is now sort of lecturing what they should have been done when he had all the information and failed to act on it accordingly. And I have been pushing, and along with other colleagues for several years now, that the NHS is completely, utterly dysfunctionally broke. And I wrote an article in the Spectator about the 4 crumbling pillars of the NHS. I had about 23 of them, but we had to limit it to 4. But I do.
Sorry, that's journalism. I'm afraid.
That's journalism for you. But it is worthwhile going over a few of them that are really, really important. The first of all is this provider-purchaser split is one of the most daft things when there is nobody really buying the services.
Internal market.
And you've got the total market, and you've got people negotiating on one side basically with themselves. I mean, the one calculation was it takes 8% of the budget. It's a total waste of time. The other one is the entering into the private finance initiative, which ironically was started by Major, and Blair and Brown said it was daft and that they wouldn't follow it. And as soon as they got in, they did follow it, because Brown said it keeps the debt off the book. And we ended up borrowing about £13 billion with a guarantee to pay back £97 billion in 20 years. And with all this outsourcing, you know, building the hospitals, what have you, at the end of 20 years, we don't even own those hospitals. They're owned by the people who put the money up. And I argue these people who did all this negotiation were the same people found guilty of libel, basically one of the biggest rip-offs of the public purse. And then the other thing that I said was really horrendous. At the time I picked it up, it was about 54 billion. This is the complaints against the NHS, and that is what they would pay out in compensation. It's now heading for 90 billion, and it's probably gone over that. Wow. It is complete. It's nearly the cost of the running it for a year. Well, it was, but now it's bumped up so much, 40% now of the GDP.
Just before you go on to Pillar 4, can we just address that topic of compensation? I mean, I have to say, I think a lot of people are really conflicted about it. On the one hand, there's a feeling that says, if you are going to have a service that you may not have paid for, that's free at the point of delivery, then you almost need to write a waiver that says, actually, if anything goes wrong, I'm not going to sue the NHS, because all that does is take away money from other patients. But surely there is also an argument that says there has to be, moral hazard. If something goes wrong, you have an operation, somebody leaves a pair of scissors inside your gullet, they need to be held responsible for that, and the way that is the most effective way of holding people responsible is with hard cash.
Yes, but the problem is it's now become an industry. It's an ambulance-chasing industry by the lawyers. And I've been involved with being expert witness in the litigation, and I can't tell you, it makes me sick. I put it one way. I said I was asked to help a patient who was, actually it was the hospital, it was the other way around, a patient who basically life had been saved, who was suing the hospital over some minor thing. And I said, the NHS has rescued this person from a rock in the middle of the Atlantic, and they're suing because they got a brace while they were being winched up into the helicopter. This is the level of complaint. Now, unlike most things, I have a perfect answer for it. It is called Australia. Australia had the same problem, and they put through the legislation which completely reduced all their claims by 90%. And my doctor friends over there have their insurance claims fall every year, whereas mine go through the roof. And all we have to do is adopt it. It would take an Act of Parliament to adopt it. But essentially, if you're having something free, to be able to actually sue when little things go wrong. Big things, yes, Australia addressed that. You know, there's a criminal compensation, etc. And before I run out of that, the fourth major pillar is is the most important, and that is we have to return to a clinically led service. That the people who decide who you're going to treat, when you're going to treat them, has to be the clinicians, and we need an administration like it was when I went in as a junior doctor. We now have layers upon layers of management who basically are not at the front end. They don't know what they're doing, and their answer to everything is to get another layer of management in, as they have just done. We're going to have 43 new super managers and 270,000, when in fact we're 100,000 people short at the coalface. Now, listen to this. We've got 40,000 spare consultants, vacant consultants in the hospital. We've got about 50,000 vacant nurses, and we've got several thousand GPs. We know exactly what's going on there. This is 100,000. Now, these posts are funded. So what is the point of asking for more money when you can't spend the money you've already got? So that is proof that this is a completely, fundamentally a failed system of delivering healthcare.
We've got 30 seconds left, and I just want to address the topic that you raised in particular in many points raised in the Daily Mail article, but this idea that we catastrophise every single year. It's going to be the worst winter in the history of the NHS. That's journalistic hyperbole. We expect that. Disappointingly, we expect that. We expect more, perhaps, from people within the NHS that represent, for instance, NHS providers or the Confederation.
Completely. And I thought that the statement from Amanda Pritchard, who's the new head of the NHS, was grossly irresponsible and verging on the incompetent, using totally the wrong figures, which are months out of date, to try and pump up the hyperbole and the hype and the scaremongering. I thought it was totally outrageous that they should be allowed to get away with it and that they don't explain the real figures. And I have real doubt about many of the figures that are bandied around about the health service statistics, I really must say.
Well, if anybody's looking to take a view on those statistics, it's a long read in the Daily Mail today, but people are very welcome to go and find it. It's fascinating.